Hello and welcome to the program. I'm your host, Neal Howard. Thank you for joining us here today on Health Professional Radio. Our guest today is Dr. Joshua Landy. He's a practicing critical care specialist. Now, back in 2012, he was invited to become a visiting scholar at Stanford University, and there he researched online and multimedia-oriented approaches to health education. And he also serves as Figure One's chief medical officer as he continues to practice medicine as well. And he's here today to talk with us about Figure One. Welcome to the Health Professional Radio, Dr. Josh Landy.
Thanks very much. It's nice to be here with you, Neal.
Thanks for joining us.
My pleasure.
You've done research, and this research has been in online and multimedia-oriented approaches to health education. Now, are we talking e-health, telehealth? What exactly is Figure One's role in this industry?
So I'm glad you put the context of the research in there, because really it was as a result of that research that Figure One came into being. Okay. Now, what I was studying at Stanford was essentially the following question. What are young healthcare professionals doing on their mobile phones to learn medicine? Mm-hmm. And everyone knows that the internet has provided just an enormous boost to the availability of interesting data and research. And it's made things so much more searchable and more easily accessible. And the things that's boosted that by maybe 10 or 100 times has been the availability of mobile devices. Absolutely. Now that people can look things up anytime, you no longer have to even leave the bedside to be able to get information about something you're seeing if you're a student or you're a learner in healthcare. Now, keep in mind that people who work in the field of healthcare remain learners throughout their entire career. Mm-hmm. Even if you're no longer technically in medical students, even if you're not still in medical school, you are still learning new things nearly every day in the clinic. Sure. Yes. So the idea that people are using their mobile devices to educate themselves and each other made perfect sense to me, and it was something that I was already seeing both in my own practice and in the practice of my colleagues around me. So essentially, this research was just meant to confirm that, people are discussing medical cases on their phones every day. The degree that they were doing it blew me away, though. The idea that this is happening tens of thousands of times every day, that a medical practitioner might have a question for their colleagues or a test for their students or a request from a learner to a teacher. And all of this is being done by describing a patient's case, sometimes taking a photograph of relevant piece of information, and sending those cases around for discussion. This behavior is so valuable, but it was being lost because people were simply texting it or emailing it to each other. And so the idea for Figure One arose out of the need or the desire to preserve all of these amazing conversations that are happening around the globe, because if you could search for a conversation that two top cardiologists had with each other so that you could learn about differentiating one arrhythmia from another, you would be able to learn a lot from just watching that conversation happen or unfold.
Exactly how far-reaching is this app, this Figure One? How far-reaching is it? Where is it being used?
Well, when we first started, Neal, it was just local in North America. Mm-hmm. Although, years later now, we're seeing the population pick this up all over the world. Our patient consent forms, which are built into the app for patients' ability to sort of permit give healthcare professionals their permission to use the case. Mm-hmm. Those are available in 47 languages.
Wow!
And the app itself is being used in 190 countries now.
190 countries and in that many languages. Okay, so it's that far-reaching. Here in the United States, what percentage of medical students would you say are actually using this app?
So this app is currently being used by over 70% of medical students.
That's huge.
It's unbelievable. And I think that it sort of speaks to the fact that most medical students today even consider themselves too young for Facebook. They find Facebook to be the old thing. Snapchat and other tools are the new thing. And we've built Figure One and learned our lessons from some of the best media companies out there. Our goal was to take these interactions and put them in a place where they can be used in a lightweight way, that people will understand how to use this tool immediately without any instruction. We're trying to build a version of a medical communication platform that fits perfectly into the 21st century. This is for today's physicians.
Okay, so a huge number of medical students here in the United States are using it, and millions of healthcare professionals worldwide are having these conversations. 190 plus countries, more than several different languages. And you're talking about mobile devices, these phones. Are we talking this app is for personal use, physician to student, student to physician, pharmacist to pharmacist, and that sort of thing? Or are there any institutions that are actually using this technology to their benefit, maybe distributing it to all of their employees or something similar?
Mm-hmm. So we've built this on what we think of as a permissionless innovation, which means we want any healthcare professional to be able to pick this tool up and interact not only with people in their own specialty, but also cross-disciplinary learning. So yes, there's lots of students teaching students and doctors teaching doctors, but there's also pharmacists teaching nursing students and physiotherapists teaching pharmacists. The network goes deep and it crosses over itself many, many different ways. In terms of institutions that are using it, we currently have partnerships with a number of groups who are using this to spread knowledge where it needs to go. So those are groups like Doctors Without Borders, the British Medical Journal Group, even the American Cancer Society, and a number of other medical journals as well.
So with all of these conversations taking place, and even with, patient consent, isn't there still a privacy issue that exists, a compliance issue when it comes to all of this extremely sensitive healthcare information?
Of course, and it was the number one concern when we started building this tool. Privacy is our number one concern at Figure One, and we know that this is a huge and important deal for healthcare professionals as well. That's why what we did was we built all of these tools and baked them into the platform. We call that privacy by design, in order to make sure that healthcare professionals always have the tools they need to be able to transmit this information while protecting patients' privacy. We even have a 24-hour-a-day privacy moderation team that reviews every single post manually before it's publicly posted to make sure that no patient private data is ever released on Figure One.
Now, where can we go online and get some more information about Figure One?
You can learn as much as you need to at the figure1.com website, or you can find it for free in the App Store or Google Play Store if you look up Figure One.
Great. It has been an absolute pleasure talking with you today, Josh Landy.
Thanks very much.
Thank you. You've been listening to Health Professional Radio, this health supplier segment with Dr. Joshua Landy. Transcripts and audio of this program are available at hpr.fm. Also at healthprofessionalradio.com.au. You can subscribe to this podcast on iTunes, listen in and download on SoundCloud. Also see us on YouTube.